Doctors, nurses, patients, and you here on The Pulse, West Michigan's healthcare show.
Well, my name is Meyers, and my title is a clinical nurse specialist in neuro. My educational credentials are, I hold a Bachelor's of Science in Nursing, I hold a Master's of Science in Nursing, and I have a certification in neuroscience nursing. Well, I started high school at Lower Norix. I was born and raised in Kalamazoo, and originally started at St. Joseph Catholic school and then transitioned to the public schools and graduated from Norix. I won't tell you when, but a long time ago. Went to Nazareth College for my undergraduate work. Met my husband there. We got married, had children, and it wasn't until my children were in their elementary school years that I decided that it was time to go back to school. And so I went to Grand Valley in Grand Rapids for my master's degree. Actually, the first time that I really gave any hard thought to what I wanted to do was when I was in 11th grade. And realized that what I thought I wanted to do, I didn't want to do, and knew that I wanted to have a college degree and I wanted to do nursing. And at that time, 3-year schools were the popular nursing schools. And I applied to Bronson here in town, Bronson School of Nursing, and in Grand Rapids, Butterworth School of Nursing. And my transcripts got messed up for Butterworth, so I wasn't accepted there. And the Bronson School of Nursing, I had to take more college testing exams, and they basically told my dad that I wasn't made out to be a registered nurse, not a field that he should encourage me to go into. But I was able to convince him to let me go to Nazareth College. It was a 4-year college. At that time, it was an all-girls college. And I angled into nursing and graduated with a bachelor's, took the state boards, and got an RN degree. I think it just goes to show that I think there's a lot of people that place a lot of stock in testing. So if a person doesn't test well in some of these intelligent tests, then we seem to want to put them into another box, and there's no consideration for what the individual's will is and what they want to do.
I've always thought that those formulas should always include perseverance, character, community service. I mean, if somebody's just tenacious and has that will and desire, obviously you did, because look at you now. That should be a major factor. And that testing is a funny thing. That here's a number, so now you're labeled.
Right.
Based on that number. I never thought that was fair myself.
Yeah, we're very good at wanting to put labels on children and people and. Well, I did my clinicals here when I was a nursing student, because Nazareth was just down the road. I actually was born here. I worked here when I was in college as a senior tech and applied. I had an offer to go into psychiatric nursing or med-surg. and I really wanted to do med-surg because that's where all of the skill, the tasks, not to say psychiatric nursing doesn't have skill, it does, but you don't do as many of the tasks, starting the IVs, putting the Foleys in, doing all of that stuff on a psych unit. And the job that was open when I applied was neuro. And so I took it. It was a combination neurosurgery floor and neurology. And I learned the majority of my skill in neuro nursing from two physicians, Senior Dr. Fabi and Dr. Moni. We would round with the physician and they would do their neuro assessments. We would watch, ask questions, why did you get this, how did you do that? So it was a lot of still on-the-job training, and that's what I liked about nursing, because you can do so many things within the field of nursing. So if being a bedside nurse is not what you want to do, there's lots of other choices, and you still have the underpinnings for being a registered nurse. So I stayed in neuro, just got hooked in it. It's a 2-year program and a 4-year program. And in a 4-year program, you end up with a Bachelor's of Science degree. So either one will prepare you for working in the acute hospital, which is Borgess, working at bedside. It's your choice to go on and do things differently. So if you opt to work in ER, to be an ER nurse, you have to go through advanced life support, trauma. So there's a lot of additional classes and education that you have to do in order to be an RN in ER. If you want to focus in OB, then there's all different classes for the OB nurse, the labor and the delivery and the neonate and the intensive care for preemies and all of that. So I think nursing is one of the fields that offers a huge variety of things. If you want to work in an acute care institution like a hospital, if you want to work in a rehab facility, if you want to work in a nursing home, physician's office, if you want to be in community health. So there's a lot of different avenues that a person can do with a base degree. I think there's a couple of things that set Borgess apart from a lot of different hospitals. We are a Catholic institution. We are part of Ascension Health, which is the largest Catholic hospital organization in the United States. We are dedicated to the care of individuals who don't have resources. We provide an enormous amount of charity care for people, not just in terms of those who are hospitalized and can't pay their bill, but in terms of they now need a certain type of medication, or they need equipment, or they need human services in their home environment. Over the last several years, we have patients who are basically homeless, and we can't return a homeless patient back to the streets. So not only do we have to take care of whatever brought them into the hospital, but then you have to look to their social, economic arena. Where can we find housing? How can we get them into that? So we work quite closely with social workers, and we have another category of RNs that are called care managers. Some people call them case managers. They help to pull everything together for those individuals who don't have a home like you and I do, don't have a family doctor like you and I do. I think that the best thing is to keep the communication open and always strive that the family, if not the patient, most of the time in neuro, the patient may have the ability to communicate, but whether they're processing all of the information. So you're not just dealing with the patient, you're dealing with their family. And you want to make sure that everybody understands what is going on. And we have doctors that come in, go out, we're a teaching facility. So we need to make sure that when we enter into that room, that that patient and family knows who I am, what my name is, what my title or category is, and what am I doing in their room. And if that means that I've got to put my name on the whiteboard, then my name's on the whiteboard. And a whiteboard is in every patient's room. It has the nurse's name, the aide's name, and their telephone numbers, so the patient or family can get a hold of directly of the caregiver at bedside. But I still believe that even when bad things happen, so you've had a surgery, and in my field, I work a great deal with people who stroke. So you've had a surgery and that individual has sustained a stroke. Somewhere from the point of anesthesia to coming out of the surgery, they stroked. So for me, I think the best is simply to be upfront with the family. This is what's happened and this is what we are doing about this. Always new technology.
It's always growing, isn't it?
Yeah. If you sort of look to see what the world of cardiology is doing, eventually that technology makes its way to neurology and neurosurgery. So in cardiology, the pacemaker implanted to regulate somebody's heartbeat. We use much the same concept to decrease seizures in certain individuals, a vagal nerve stimulator. We have the ability to do deep brain stimulation for Parkinson's disease. So as far as the technology can advance, I think Borgess will be there. We're very much into that cutting edge. Probably too many to mention. I say that I moonlight at the West Michigan Cancer Center. I work with a neurosurgeon. His name is Dr. Richard Durenberger, and his concept about 14 years ago was to develop a neuro-oncology clinic and have all of the specialists, the neurosurgeon that did the operation for the brain tumor, the radiation oncologist, the medical oncologist, all at one spot, seeing the patient and the family. Prior to the onset of that clinic development, when a person had a brain tumor, they saw the neurosurgeon, recovered. A couple weeks later, got referred to the medical oncologist. Maybe a couple weeks after that, got referred to the radiation oncologist. A couple weeks after that, you know, back and forth. And when symptoms or side effects were to happen, the family, who do I call? Do I call my regular doctor? Do I call the neurosurgeon? Do I call the medical oncologist? Do I call the radiation oncologist? Who do you call? And people had always said to me, oh, it's a horrible clinic. How can you do it? Aren't you depressed? And I look at them and I said, you know what? There's nothing more challenging than working with somebody who you know is going to die ultimately from that brain tumor. So the goal for me is two parts. Making it as easy as possible for that family to get through that experience and to value what I have. Because right now, I don't have that brain tumor and none of my family members do. So I use that.